The urinary system. The urinary system helps maintain homeostasis in the body by 1. Regulating water balance, 2. Removing harmful substances such as nitrogenous waste or harmful chemicals from the blood, 3. Regulating blood volume and pressure, 4. Regulating the osmolarity of the body fluids by controlling the relative amounts of solutes, 5. Producing erythropoietin, 6. Converting vitamin D3 to calcitriol. Next, we're going to be talking about the anatomy of the kidney. Each portion of the kidney is labeled using a number. Number 1 and number 13 are the minor and major calyxes of the kidney. They extend into the renal medulla and the renal pyramids. The calyces collect urine in the kidneys. Number 2 labels the arteries and veins in the renal sinus. Because the major function of the kidneys is to filter the blood, a rich blood supply is delivered by these arteries and veins. Number 3 is the cavity that lies inside the kidney. It is called the renal sinus. Number 4 is the interlobar artery. It passes between the renal pyramids and it goes toward the renal cortex. Next, number 5 is the interlobular veins. Number 6 labels the renal pyramids of the kidney. They consist of striated cone-shaped regions. Number 7 is the unstriated regions between the renal pyramids. They are called the renal columns. Number 8 is the fibrous capsule of the kidney. It is an inner fibrous membrane that protects the kidneys from trauma and infection. Number 9 labels the renal cortex. It borders the convex side of the kidney. Number 10 is the renal medulla. It lies adjacent to the renal cortex. The renal artery branches off into 5 small arteries. These are called the segmental arteries, and it is labeled by the number 11. Next we have number 12. It is called the renal hilum. It is the medial surface of the kidney. It is concave and has a vertical cleft. Number 14 is the renal artery of the kidney. It divides into 5 segmental arteries. Number 15 is the renal vein. It exits from the kidney and empties into the inferior vena cava. The kidney consists of over 1 million individual filtering units called nephrons. Nephrons are the structural and functional units that form urine. Each nephron consists of a filtering body, the renal corpuscle, and a urine collecting and concentrating tubule, the renal tubule. The renal corpuscle is an assemblage of 2 structures, the glomerulus and the glomerular capsule. There are 2 kinds of nephrons. The first kinds of nephrons are cortical nephrons. They represent 85% of the nephrons in the kidneys. They have loops of Henle that descend only slightly into the renal medulla. Then we have the juxtamedullary nephrons. They have long loops of Henle that descend deep into the renal medulla. They play an important role in the kidney's ability to make concentrated urine. They help maintain ionic and water balance. Next, we are going to talk about how urine flows in specific organs in your body. First, the urine accumulates in the left and right kidneys. Then, the kidneys are connected to ureters, which the urine flows out of the kidneys into the ureters, and the ureters are structured behind the urinary bladder. The urinary bladder then connects to the urethra. And if you are a male, then you have your prostate gland surrounding the urethra. But if you are a female, then you do not have a prostate gland. A prostate gland, sometimes as you get older, in males, it enlarges and that obstructs the flow of urine. Next, I'm going to be explaining a couple of different topics and disorders of the urinary system. Renal ptosis is a rare condition when a person's kidney drops down into their pelvis when they stand up. Pyelitis is inflammation of the renal pelvis. Pyelonephritis is an infection or inflammation that affects the kidneys. Kidney infections in females are usually caused by fetal bacteria that spread from the anal region to the urinary tract. In several cases of pyelonephritis, the kidney swells, abscesses form, and the pelvis fills with pus. Untreated, the kidney may be severely damaged, but antibiotic therapy can usually treat the infection successfully. Anuria is an abnormally low urinary output. It's usually less than 50 milliliters per day. It indicates that glomerular blood pressure is too low to cause friction. Renal failure and anuria can also result from situations in which the nephrons stop functioning. Chronic renal disease is defined as glomerular filtration rate of less than 60 milliliters per minute for at least 3 months. It often develops slightly over many years. Hemodialysis is when you implant an artificial kidney into a patient. Renal calculi, or commonly known as kidney stones, is when calcium or magnesium salts or uric acid are concentrated in urine. They may crystallize and precipitate to create these stones.